Welcome to Beyond Diagnosis, how physicians counsel patients on living well across specialties. In this podcast, we learn from the experts how all specialties practice preventive medicine. This is geared towards medical students who spend countless curricular hours learning the disease model and how to treat sick patients. This is a supplement to help us improve the lives of our patients by promoting optimal health and well-being, addressing the root causes of many conditions. My name is Michelle Omega, fourth-year medical student, hoping to one day be a family med doc, and today I have the honor of being with our expert in obstetrics and gynecology, Dr. Mass. Welcome, and thank you so much for being here, Dr. Mass.
Thank you for having me.
First, the formalities, disclosure, this is for educational purposes only. Please see your doctor if you have any concerns about your health. Second, Dr. Mass, I just wanted to confirm verbal consent to publish this episode.
You have my consent, thank you.
Let's get right into our introduction. Dr. Sharon Mass is an obstetrician-gynecologist in private practice in Morristown, New Jersey, and serves as the medical student clerkship director for the Department of OBGYN at Morristown Medical Center. She is clinical associate professor at the Sidney Kimmel Medical College of Thomas Jefferson University, which is where she graduated from medical school, as well as completed residency training. Dr. Mass has held local, regional, national, and international leadership positions in the American College of Obstetricians and Gynecologists, called ACOG, for 30 years. She currently serves as chair-elect of ACOG District 3, is chair of the Breastfeeding Expert Work Group, and represents ACOG on the United States Breastfeeding Committee, and is an editor of the ACOG Breastfeeding Handbook for Physicians, now in its third edition. She has also been recently appointed to represent the United States on the International Breast Health Committee in the International Federation of Gynecology and Obstetrics, called FIGO. Dr. Mass has been invited to speak about her expertise on women's health, breastfeeding, and breast imaging at numerous medical centers around the country, and is frequently quoted in the media on these and other topics. Dr. Mass has repeatedly been named as a top doctor in the New Jersey Monthly Magazine. And from my anecdotal experience, Dr. Mass is truly a top teacher that I have worked with, and my classmates say the same. So it is so great to see you again.
It's nice to see you, and that's probably the highest of all those honors, so thank you.
So to start off, could you tell us broadly what conditions you treat?
Sure. So I am a practicing obstetrician-gynecologist, and so in that capacity, I take care of women throughout their reproductive lifespan, from basically adolescence through menopause. In terms of preventative care, we take care of adolescents, looking at contraceptive care, menstrual management, those kinds of issues. We take care of people through their reproductive life, including fertility and infertility, conception, pregnancy, postpartum care. And then we take care of patients through their sort of perimenopausal and menopausal years, dealing with transition to menopause, general medical health, and issues related to elder care like prolapse, incontinence, and other issues. So really taking care of women across their reproductive lifespan.
What does your typical week look like?
Sure. So I am a general OBGYN. So that means at this point in my career, I practice both obstetrics and gynecology. And I basically have three parts to my professional life. Part one is being on call and taking care of laboring patients and hospital-based obstetric patients. Part two is the surgical part of the practice, which is performing outpatient primarily, but occasionally inpatient surgery on the uterus, the ovaries, and any other reproductive structures. And then part three, and really the bulk of my week, is spent in the office. So I take care of patients in an outpatient doing well woman visits, problem visits, and prenatal care in the office. Over the course of a typical week, for my practice, I'm on call 1 day a week doing inpatient work. I'm off 1 day a week, and the other 3 days a week I am in the office.
So in the office, what are the healthy lifestyle habits or behaviors that you counsel patients on in your field of OBGYN in particular?
So I think that's a really great question. And obviously taking care of people in a wide range of ages, those preventative care measures vary greatly. But in a younger population, we're dealing with a lot of psychosocial issues, things like tobacco, alcohol, drug use, contraception, sexually transmitted infections, both educational awareness about what they need to focus on, as well as treatment if there are issues. In the mid-level population, I would say we're starting to screen for issues of heart health, things like cholesterol, hypertension, other general medical issues, screening for thyroid disease, things like that. And then in the later health populations, we're starting to look at preventative measures. So screening mammograms, talking about colon health and screening for colon cancer, talking about bone health and screening for osteopenia and osteoporosis, screening for psychosocial issues through all of that, relationships, and how to make sure that each patient maintains her own general wellness and personal health as well. And I would say a new focus in our field has been really looking at depression and anxiety screening across all of those lifetimes. So we're learning how to really identify issues of anxiety, depression, and general wellness, and to incorporate that into our preventative care visits.
Do you have any particular strategies or goals when you're counseling patients to actually make these changes?
Well, I think the primary goal that I have is to look at what are the national standards for health and to make sure that we are both screening for those things as well as educating patients about them. So, it's a matter of identifying sort of what is the mental checklist of what we want to cover. And I will say both American College of OBGYN, American Academy of Family Physicians, American Academy of Pediatrics does have kind of checklists and things that they encourage their practitioners to look at each well visit. And then just trying to assess what the issues are for the individual patient as well, where she might be having problems or challenges, and addressing how we can help with those as well.
And do you ever explain to patients how, for example, unhealthy habits affect the gynecologic or reproductive system or the health of the body overall?
Sure. So I think, part of your question is how do we address things that we identify that might be a problem for the patient? So perhaps I can use a couple examples and talk about both the strategy and the challenges for those, right? So one example that affects, a reproductive population is sexually transmitted infections and safe sex practices. So, some of the things that we're going to try to identify are how many partners they have, what their relationship with those partners is, whether they're practicing safe sex using barrier methods, condoms, that kind of thing, whether they're practicing pregnancy prevention. And it's both a matter of being comfortable asking those questions as well as, dealing with responses that may be surprising or challenging. So that's one example. I think another example is the topic of obesity, which comes up in pretty much any population, whether it be young women, whether that be pregnant patients, whether that be older women. And weight is, in our society, a very sensitive topic. And so, for example, when I have a pregnant patient who is gaining weight at a rate that is far above recommendations, it's a little bit of a challenging circumstance that we have to deal with. If you want, I can share an anecdote about that.
Sure, please.
At one point a couple years ago, I had a patient who was gaining too much weight in pregnancy. And the concern with that is twofold. One is that it makes for a potentially much larger baby, which makes for a difficult delivery and a higher risk of a C-section. And number two, it's not obviously great for the mother's general health in the future. So when she had already gained about 40 pounds at 30 weeks of pregnancy, which is about, 2/3 to 3/4 of the way through the pregnancy, I pointed out to her that her rate of weight gain was too high, and she immediately burst into tears. I felt bad. She subsequently left the office in a huff. She went online and posted some fairly unpleasant things about the way that she was treated in the office. And I was surprised by all of that because the tone and the intention were all positive.
Right.
However, she refused to see me for the rest of the pregnancy, and I'm in a group practice, so she didn't have to. But in her subsequent pregnancy, she came back to me, and about midway through the pregnancy, she said, "Dr. Mass, I really hated you my last pregnancy, but I need to talk because you were correct. And I did watch my weight for the end of the pregnancy, and I did successfully have a vaginal delivery. And while I may not have appreciated it at the time, in retrospect, I am very grateful. It's happening again, and I need you to get me in line." And, she has actually been my ongoing patient since that time. So it just shows that sometimes the relationship and the conversation can be challenging, but when you actually have the patient's best interest in mind, they hopefully can come to see that.
How do you think she made that transition to come back to you?
Like I was saying, it's a sensitive topic and nobody wants to hear that they've gained too much weight. I think in her mind, it translated into, "You're telling me I'm fat," which was not the intent. But with some retrospective assessment and seeing that her outcome was a healthy one, I think she was able to put that into a new perspective. And I hope that's always the intention.
I really enjoyed that story. And I was wondering, at what age should a patient start seeing a gynecologist, assuming they do not have any gynecological symptoms, such as menstrual irregularities or some other issue that they want to come in to you to talk about?
Sure. I think that's a great question. So I'll give you the official answer from the American College of OBGYN, which is that patients should initiate gynecologic care at age 21 and or for sexual activity. What I say to my patients, or those that have teenage daughters, is that I also like to establish care before that. So in patients who are willing, I often will recommend that they come in when they're getting ready to graduate from high school, perhaps go off to college or start a new job or new career, just so that if they were to have a problem when they were away from home, that they would have a familiar face and know where to call and not have to, particularly for a child going to college, rely only on student health for potential issues or care. So, if that young woman is not sexually active, I don't necessarily do a full pelvic exam during that visit. It might be more teaching them a self-breast exam, talking to them about some of the preventative care elements that you and I just discussed, and really establishing care, establishing the importance of confidential care, that they know they have a place to go, and then being a resource for them when they are perhaps away from home for the first time.
Should women be having regular visits? Would you say yearly?
Yeah, so our recommendation is still to have yearly visits. I will say for some patients, the changes in Pap smear guidelines have confused them because in the olden days, when I first started practicing, every woman had a Pap every year. And these days with new guidelines, the intervals can range from 1 to 3 to 5 years. And some patients have taken that to mean that they don't need an annual visit. So we do like to reinforce that it is a well-woman visit or a preventative care visit, and that encompasses all of these things that you've just so well outlined.
Are there any specific health markers or indicators you use to evaluate their health at these well-woman visits, for example?
I think you can answer the question in two ways. So there are a lot of organizations that are looking at benchmarks and metrics and things like that to say, this is a complete visit and the patient is up to date. So I would say some of those might include when was the last Pap smear, when was the last mammogram, when was the last bone density if age appropriate, last colon cancer screening if age appropriate. But outside of that, the general guidelines include vital signs, weight, breast exam, pelvic exam, and any reproductive issues that can be addressed during that visit. And, sometimes we have to bring them back and address the problems or the reproductive issues at a subsequent visit, if it's something that is beyond the scope of preventative care.
And what is the extent that modifiable risk factors play a role in some of the conditions you treat in your specialty? So is there a potential for me to intervene early through patient education?
Yeah, so I think that's a fantastic question. One of the prime opportunities is somebody who is considering a pregnancy. So that is a time where what we call a preconception visit to optimize health prior to getting pregnant can be very valuable. So some of the things we might address during that kind of visit would be smoking cessation or, elimination of other toxic habits. It might include medication management, for example, if they are on a medication that is less optimal in pregnancy. Weight, blood pressure, and diabetes optimization. So if they are hypertensive or diabetic, is there a way of getting that blood pressure or that diabetes under control prior to pregnancy? And certainly, weight has a lot of negative impacts on pregnancy. And so if they can work towards weight loss prior to conception, then they have a better chance of a healthy outcome with their pregnancies.
Now, the big question of this podcast is, what could robust health in your field look like for your patients? What does it look like beyond the absence of disease, like exceptional, optimal health? Does this apply to OBGYN?
Sure. Again, a great question. I think, robust health is a matter of optimizing mental, physical, and psychosocial health, right? So it's feeling safe in your environment. It's making sure that your mental health is cared for. In this day and age, that your personhood is cared for. I know that we're dealing with a lot of struggles with gender identity and things like that. So making sure that people are seen and heard and valued, and that their physical health is optimized. And that is something that we as women's healthcare providers really have the privilege of taking care of and helping people with all of those aspects of their care.
What are some of the barriers you've seen that hinder patients from achieving these health markers to live well that you mentioned?
Well, so the barriers vary, I think, depending on where a patient lives, what their insurance resources and their financial resources are. But, certainly access to care is not an issue in my area. I live in North Jersey, New Jersey. But, I don't want to get political here, but across the country, access to care is rapidly becoming a major issue. There are what we call maternity deserts across the country, where there are counties and regions that there is no practicing obstetrician in entire counties, and in some cases up to several hundred miles from those patients. So, first issue is, do they have insurance and can they actually get in to see a doctor? Second is there a doctor or another healthcare provider in their geographic area? And it's just astounding in the United States that those maternity deserts and reproductive area deserts exist. And then, do we have adequate providers? We are estimating that in the future, we may actually have inadequate numbers of medical healthcare providers for all of the patients who need women's health care. We have a lot of racial and ethnic barriers in our country, and certainly a lot of disparities that we are working on making sure that patients are cared for in the environments where they feel safe by providers that look and feel like them, so that they can, have confidence in their care. So those are all things that we're working on in the women's health arena.
And what is your advice for how physicians can advocate for patients on the population level or national level or beyond, in your case?
So, being an officer for the American College of OBGYN has been a real privilege across my entire career. And I think that is one of the things that our national organization does tremendously well. So we have a lot of resources for patient advocacy. One of the most exciting of them is that every March, we convene OBGYNs from across the country to meet in Washington, D.C. for both an educational as well as a lobbying endeavor. And so we have people that come from all 50 states. This year there were 700 OBGYNs that convened in Washington, D.C. and then went out to meet with their legislators on Capitol Hill. And when we do that with very specific asks in mind. So, just as an example, this year the two asks were to make sure that reimbursement rates were not cut at a rate that would, push more people out of the field. And secondarily, that some of the initiatives that we have for prevention of maternal mortality be maintained, because some of the budget cuts were going to eat into things like maternal mortality review committees. So we went out to our various state legislators, both senators and representatives from across our states. We met with them, and I will say in particular, we had some amazing meetings with some of our New Jersey legislators, both our senators as well as I got to meet with staff from Mikey Sherrill's office, and they were so receptive to all of our ideas and really interested in partnering with OBGYNs from around the state to make sure that we optimized women's health in the state of New Jersey.
We go into this career to help people, and it's also as important for physicians themselves to take care of their own wellness. Is there anything you do in particular to maintain your own well-being in a field that can be stressful?
Well, anyone who knows me well knows that there absolutely is one. So I am a Peloton freak. And so I, long have enjoyed my Peloton bike, but I will say that I have made a commitment to myself. Anyone who knows Peloton knows that every day that you do a Peloton workout, you get a little blue dot on a calendar on the Peloton app. So I have made a commitment to myself that I will get a blue dot every single day of the year, even if it's not a full workout. Sometimes it's a little 10-minute core workout or a 5-minute meditation, but I will get a blue dot every single day. And I will say April 28th is the only day in the past year that I have not done so. There you go. And I'm very distressed. I was on call, and at 2 in the morning, I was like, I didn't do a Peloton workout. And everybody tried to make me turn the clock back on the Peloton app. So I am absent a blue dot. However, I do it as a commitment to myself to say that general wellness is important and that exercise is important. And so by having to do something, no matter how tired or long my day is, I do something on that app. And I will say I've made a concerted effort to have some of those somethings be yoga and meditation and things that are just better at sort of quieting the mind and centering myself, because I am not very good at that.
And lastly, do you have any advice for medical students? This could be finding a specialty they're passionate about or anything.
Yeah, well, I think medical students have the whole world in front of them, right? So you are at just such a wonderful time in your life, especially as you enter into this fourth year of medical school, your final year. I remember when I was at that stage, somebody said to me, you are at the peak of your general knowledge. You know more about everything than you will ever know again in your future. But you will have the opportunity to become an expert in your field. And so, I would say just 2 or 3 things in response to your question. One is what you said is so important. Make sure whatever you do, you have a passion for, because this is the rest of your life. And as hard as a career in OBGYN can be physically and emotionally and mentally, I wouldn't change anything, even 30 years later. So that's first. Second is make sure that you go and you find support and mentors. I've been able, you gave me a beautiful bio, but I will say that most of that was because somebody helped me along the way. And having mentors and advocates is incredibly important. And when you find those early in your career, it's a real blessing. And then, the final thing, and this is just sort of a fun thing and an aside, but in my spare time, I help my husband with his platform, and his is a marketing platform helping individuals figure out their personal brand in one word and using that to know who they are. And I have had a lot of medical students, particularly those at your stage of the career, who are starting to apply to residency or thinking about their jobs, who have gone through his free program. And I'm not, going to get into that here, but just to say that knowing who you are and what you want to do is incredibly powerful. And if I can help any of your medical students or listeners learn more about that or anything else in the field of OBGYN, I'm happy to be a resource to all of them.
Thank you so much, Dr. Mass.
Thank you. Always a pleasure. And best of luck to you and all of your peers and colleagues. You have a great future ahead of you.